Good evening. On a day when 18 people have died from COVID-19, we begin with more fallout from BC's deadliest care home outbreak. A recording revealed staff members were going to work last month even though they had COVID-19 symptoms.
The recording is seen as a tragic example of BC seniors dying, not just because of the pandemic, but also because not enough is being done to protect them. CTV's Penny Daflos has our top story.
1/3 of the seniors who lived at Little Mountain Place have died from COVID-19.
I'm sorry, I do still get emotional.
In leaked recordings, the executive director was upset while discussing the outbreak with family members. They put much of the blame on management for secrecy, late response, and a work environment that saw short-staffed employees putting in long hours, many experiencing fatigue and aches that were actually symptoms of COVID-19.
People who are pushing through things and probably explaining away things in an attempt to really help the site out.
Exposing residents to COVID despite this message from day one.
If you're sick, stay home.
On the ground.
There's no question that over the last few years, in the face of a very, very serious staffing crisis, that workers do feel some pressure to come into work when they're not feeling a little unwell.
The BC Care Providers Association disputes that.
Certainly not our experience. Operators I have talked to have told me of instances where they've actually told people to go home because they don't want to bring the virus into the home.
But health officials say care workers throughout the region are feeling pressure from multiple sources.
It might be coming from the facilities, it might be, the professional duty that people feel, as well as sometimes connection with the teams, because people know that people have to work harder.
Reducing that pressure isn't just a question of money, but also recruiting and training more people to do a rewarding but challenging job.
We have to have a really good look at how we're treating workers in the long-term care system.
3/4 of care home staff are unionized, but sick day allowances vary greatly.
We need to make sure that there's adequate level of staffing and support available.
There are also renewed calls for rapid testing, which the provincial health officer says isn't reliable enough.
Rapid testing would eliminate the entrance of someone with very mild symptoms or someone that is maybe playing them down for because of a sense of dedication.
And perhaps help better protect BC's most vulnerable seniors. Penny Daflos, CTV News, Vancouver.